Hi, I'm Dr. Rajdeep. I'm a dermatologist and dermatosurgeon practicing at Charma, which is a part of Chirag Hospital in JP Nagar 2nd Phase, Bangalore. Are you over the age of 65 and you have some painful nodules on your legs? And do you think you could be suffering from a condition called Erythema Nodosum? Well, Erythema Nodosum is a rare clinical disorder which is seen most commonly in teenagers to mid 30s, but it can be seen in the older age group as well. So when we see a patient of Erythema Nodosum, we notice that they have some red color, tender, that is when we touch it, it pains, swelling on the bottom half of the legs below the knees. This is proposed to be some sort of allergic reaction to many things. Many underlying conditions can be there. In most of the cases, it's self-limiting. That is, it doesn't need any treatment. It resolves on its own in about 6 to 8 weeks. But for some people, it can persist up to 6 months to even 2 or 3 years. So it can keep coming, reducing, increasing. All that is possible. You might notice that along with these nodules, you have a mild fever and joint pain, like you have a flu or a viral infection. So when we see a patient of Erythema Nodosum, especially in the elderly, we have to rule out certain dangerous conditions like non-Hodgkin's lymphoma, which is a type of blood cancer. We have to rule out other conditions like infections of the throat, which is the commonest cause. Infections like tuberculosis, that is, it affects the lungs, and another condition called sarcoidosis, which is very similar to tuberculosis and also affects the lungs. So we need to get an X-ray done for the lungs to rule out that. We need to check the urine for certain urinary infections and other abnormalities. We need to check the stool for stool infections. Sometimes even typhoid can cause Erythema Nodosum. So there are so many causes for Erythema Nodosum. We have to rule out all of them one by one. Even in case of people who are having rheumatoid arthritis for many years, after about 5 to 6 months of developing rheumatoid arthritis, they might develop this Erythema Nodosum. Some people who have inflammatory bowel disease like ulcerative colitis or Crohn's disease, they can also develop Erythema Nodosum. Then some people who are taking hormonal medicines, especially after menopause, if they want to take hormonal medicines for hot flushes and things like that, those hormonal pills can also cause Erythema Nodosum. In older age, people taking anti-diabetic medicines, if they contain a particular group of medicines called sulfonylureas, that can also cause Erythema Nodosum. The list is very long. So if you notice that you have tender, painful red nodules on your leg, with a mild feverish feeling and joint pains, please visit your dermatologist and try to rule out the underlying causes. If no underlying cause is found, you can be given symptomatic treatment and it will resolve in about 6 to 8 weeks.